We spend a lot of time on strategic planning, and of course it always includes our residents because they are the foundation and the backbone of what we do here. And we've done a very good job in the past few years under the leadership of Dr. Waite and his successor, Dr. Lewis, in establishing good depth. So we have faculty at various stages of their career, some very early stage and some at the latter stages of their career. So because of that, residents can come in very confident that they won't have a program that suddenly loses accreditation or suddenly loses exposure to a skill set.
We have a very stable program with outstanding faculty, many fellowship trained faculty with subspecialties who will provide a broad scope of training, and the diversity of this training experience really will prepare them for a career in anything that they choose.
The great thing about UAB is that we have multiple hospitals in a very tight area. No traveling, everything's close. Children's Hospital, VA Hospital, clinics are all right here in Birmingham. And we can do everything right here without having to do outside rotations in another city. So for the resident, I think this is a great place to live. There's a tremendous experience for the resident, and they can be close to home.
And then the surgical aspects, we do everything from arthrocentesis, arthroscopic surgery, particularly operative arthroscopy, which I would say there's probably only a handful of programs in the country that can do.
The thing that really drew me here the most was that, for choosing a residency, I really wanted a couple main things. First of which, I wanted a busy clinical experience. And the other thing is I really wanted just to have a variety of different clinical procedures that I was exposed to, and just all different kinds of pathologies and trauma and cancer that's really within our field.
I think that we have the ability to recruit just the top-notch people. So you're always going to have excellent people to work with. The faculty, they're very involved. They really care about the residents and how they're doing, and there's just so many opportunities.
You get the chance to work with a surgeon one-on-one and learn not just how to do what they do, but how to think in the manner that makes you a surgeon, and how to really take on that mantle of making the right diagnosis and the right decision before going ahead to surgery.
We have a large scope of faculty. It's a very diverse faculty who all have areas of training and expertise, and they bring those specialty areas of training to the residency training program.
So it's very unique in that we have the ability to, because we're in a dental school, interact with dental colleagues on a daily basis. So our oral and maxillofacial surgery clinic starts off with dental alveolar procedures so that residents can do extractions and wisdom teeth removal, as well as dental implants, and interacting with their colleagues in a dental school setting, would be unique, and probably only half of the programs can offer that.
In addition, the residents are extremely cohesive and supportive. This is not a cutthroat competition residency program. The residents work together very well, and the faculty support them at every step of the way.
So the future, I think, is very bright because we have a fairly large corpus of faculty to provide not only education but mentorship to the various residents.
We also have great longevity. Our program started in 1948. So we have many decades of successful trainees graduating our program and entering any aspect of private practice or academic practice that they choose. And because of that, we're very confident that we can give our future trainees, our future residents or fellows the chance to go anywhere and shine and carry on that good UAB name and that legacy into the future.
We have a lot of young faculty, a lot of young energetic faculty that really enjoy teaching. They really try to get you in the OR as much as possible to create a really good learning environment where you as a resident can really work hand in hand with them throughout different procedures and different cases.
We are really more than just the dental school. We're outside of the dental school. So as UAB is a major medical center, we're a major player in that hospital.
The opportunities for research are very vast and broad. We have world-renowned scientists for bone biology, for signaling and transcription, for epigenetics. I myself work on cancer biology. And then for the residency, there's, again, lots of opportunities in terms of different surgical techniques. We have a microvascular fellowship, which separates us from other institutions as well.
You really see all facets of oral and maxillofacial surgery, from everything from head and neck cancer cases to dental alveolar cases to cleft and craniofacial cases, that there are very few other hospitals throughout the nation that expose you to everything at one institution.
We don't rely or need outside rotations so residents don't have to travel to England or other parts of the world to get their trauma experience. We have a very diverse base, so a trauma rotation, an orthodontic rotation, a cleft pediatric rotation, a cancer rotation.
And once our residents complete the program, they're really well prepared to enter a career in private practice, in faculty practice, or even in research if they so choose.
It was pretty clear early on that they really offered unparalleled training here. To see the confidence that the residents and the fellows had while training here was pretty eye-opening, to say the least. So it was something that I definitely wanted to become a part of.
The reputation of our residents have been very strong, so individuals that know of us and know our program would say that those students are typically standout because they have had some clinical experience already, but not only that, they typically are the upper echelon of students with regards to motivation and curiosity and intellect.
Also, I've always felt that the residents really get along with each other very well, and they work together very well. And so those kind of lifelong friendships and bonds that they make through this training experience only makes the training experience stronger for them.
And by the end of it, the residents tell me they have gotten a great experience with soft tissue planes, learning how to manage the neck properly, learning how to approach the facial skeleton through the soft tissue planes, dealing with complex irradiated tissue or burn tissue, and all of the things that make you a better, well-rounded surgeon. Not just learning procedures, and not so much learning how to be a cook, but how to be a chef. Not learning procedures, but learning how to operate. That's what we hope to teach you on these rotations.
So again, that combination of a balanced program, enhancements with the medical school, and enhancements with a broad approach to education, I think just makes UAB one of the programs that is premier in the country. And if you haven't heard about us, you need to take a look.